Hi y'all, I hope you and your loved ones are doing as well as can be today. So today I have a cardiology appointment at the Dysautonomia clinic and I have the results of my ultrasound for my ovarian cyst.
Taking the good with the ups and downs. I wanna see how the world turns round. Let's go adventure in the deep blue sea. Home is with you wherever that may be. Home is with you wherever that may be.
Just had Echocardiogram, which is an ultrasound on my heart. I think this is part of the medical evaluation to get medical clearance for surgery, but it's also like a routine test for me. I haven't had it in like over a month, so I was due. Just here waiting for an EKG. We've been in this room for like 30 minutes. It's always a lot of waiting at the Dysautonomia clinic. You can't plan anything else for the day that you have a Dysautonomia clinic appointment. It's all day, but hopefully I won't have to come back here for more of the same tests to get the medical clearance that I need for the surgery. But yeah, I'm gonna give an update soon about the results from the last follow-up ultrasound that I had. Well, how long were we in there, Mama? In like 3 hours? Over 3 hours. It was almost 4 hours. I think that's the average. We spent 4 hours at the Dysautonomia clinic, and unfortunately, the doctor did not clear me for surgery. She wouldn't give me medical clearance. Today is the next day, the day after my appointment at the Dysautonomia clinic. I'm just here eating some grapes. I was too tired to film yesterday, to finish filming. So we were actually at the clinic for 4 hours, which is average. I had my echocardiogram, which is a heart test. It's an ultrasound of the heart, and it shows the heart in great detail. So I have that like every month or so. It's routine because I have POTS as well as heart valve disease. Also needed some other testing done that I was overdue for, like a tilt table test, EKG, all that stuff. And the goal was to get medical clearance for the surgery to remove the ovarian cysts and fibroids. So unfortunately, I did not get the medical clearance that I had hoped for. My POTS cardiologist denied me based on two things. One, she said, was my high blood pressure. She said it's dangerously high still. she showed me the results of my last 24-hour blood pressure monitor, which you can see the video right up here. That was about a month ago, like 4 to 6 weeks, excuse me, 4 to 6 weeks ago. I had taken home a 24-hour blood pressure monitor that they fitted me for, and that's just a routine thing for me since I do have hypertension from hyperPOTS. My POTS affects my blood pressure, as POTS usually affects the blood pressure, but usually it lowers the blood pressure dangerously low. For me, it not only goes low, but it gets really high, and I've actually been more high than low these days. Despite my beta blockers, I'm already on 2 blood pressure medicines that are not working. So I stopped the metoprolol, and she replaced that for Coreg. This is another beta blocker which is supposed to lower my blood pressure, but hopefully not too low, because the metoprolol was bringing it too low to the point where I was almost fainting again and like getting really dizzy every time I stood up. So the Coreg I did start yesterday. It's with food, which is different. Most medications are not with food. That makes it a little more challenging since I do have cyclic vomiting syndrome, suspected gastroparesis, I have gastritis, IBS, a bunch of stomach issues. I did have a little baby food this morning, and I took the new beta blocker with the baby food. So my cardiologist said that it's supposed to help with not just the blood pressure, but with my chest pain. The chest pain is from angina, from lack of blood flow to the heart. It's also from my POTS and low blood volume. I don't have enough blood in my body. This is why I get daily IV fluids through my central line. So anyway, the other issue first was my blood pressure, but she also denied me because I have something called effusion. I think she said it was called pericardial effusion, if I'm not mistaken. It's an abnormal buildup of fluid around the heart, and this puts more stress on the heart, and it's a big problem. So unfortunately, because of that and my high blood pressure, she denied me for medical clearance, and I'm really disappointed, to be honest. That's not what I was expecting. I thought that I thought everything was stable enough to be approved to get a medical clearance for surgery, but I guess not. So I was disappointed, and I am just hopeful and praying that the 2 medicines that I've recently started will help me with everything, with my blood pressure, with the fluid around my heart. So I'm going back in 2 weeks to check my heart again and my blood pressure. She's going to do a repeat echocardiogram, and if I still have fluid in the heart, we're going to have to discuss treatment. Catheterization, like there's like a catheter procedure where they put a catheter in your heart and like drain the excess fluid around your heart. It is considered like a minor surgery. It's a big heart procedure, so hopefully I don't need that. It has made my breathing worse again. I was at the point where it had been better. It's been really bad, and I wasn't sure. The last few days it was getting bad, and I wasn't sure if it was my mast cell activation, because my mast cell allergies have been really bad this week. Could be a combination, but this excess fluid around the heart does cause chest pain, which I already have, the shortness of breath, so I had to go back on the O2, and it's just as needed. It's not like all the time. I try not to be dependent on it. It's hard to get organic grapes. My mom got some organic grapes. Happy about that. Now that we talked about me being denied for medical clearance, which was a big bummer, I have to tell you my results of my last follow-up ultrasound that I had last week at the hospital to check on my complex ovarian cyst on my left ovary. I also have a ton of fibroids, uterine fibroids, which are hard, solid, like tumors, but it's benign, so it's non-cancerous. But they're pushing, the fibroids are mostly on my right side, and they're actually pushing up against my right rib, and this is causing horrible rib pain. I already have rib pain already from EDS, arthritis, and Sjogren's, but the last 2 weeks it's been much worse, and I just equated it to my Ehlers-Danlos syndrome. I thought that it was the EDS causing that, but I think it's a combination because I sublux a lot, especially when I lay down to sleep. Like it's a partial dislocation of my rib, so it's really painful, and that usually happens on my left rib, but it's been happening on my right rib. Now I know why. This is the part that I wasn't expecting. I actually have 2 more cysts, so I have a total of 3. At first I thought it was just 2, like one extra one from the last ultrasound on July 7th. No, it's 2 extra cysts. So I have another ovarian cyst on the right side, and then I also have a Nabothian cyst. But the good news is that one is normal, or like it's harmless is what I was told, so I don't have to worry about that one, thankfully, for once, right? But I do have the 2 cysts that I have to remove now, as well as all the fibroids. The one, like, I guess good in this is that the original cyst, the first complex ovarian cyst that I had, did shrink a little bit, not much, it's still really big, but it did shrink a little, so that's a good sign. I'm hoping it'll keep shrinking. I already suspected I had something going on the right side because my pain had been radiating to the right side for over a week now, and so I suspected something was going on. And when I was in the hospital, I finished the ultrasound and I looked at the computer screen and I saw like red. Red usually means something is wrong, so when I saw red on both the left ovary and the right, I knew that I had gotten even more cysts. So you guys, I don't know what's going on. I don't know why it's spreading. It could be from my adenomyosis. My hormones, they said, were normal, which was actually really surprising. That's pretty much what's going on. I have 3 cysts and a bunch of fibroids that I have to get rid of. I at least have to get rid of the 2 cysts that are causing problems. They're causing a lot of pain and bloating, nausea, vomiting, more than usual. Like, I'm always nauseous, but I'm more nauseated. You know, my appetite hasn't been too great. I get full easily. I have extreme gas pain, like horrific gas. And I don't mean like releasing or passing gas, but just like the cramps and the pain from gas. It's been really bad. It's pushing up against my bladder and my bowels, so I've been chronically constipated despite using daily stool softeners and laxatives, and my bladder is not able to fully empty. So even though I catheterize as needed, I use catheters to empty because I have neurogenic bladder. My bladder is partially paralyzed. For at least 6 months to a year, I haven't been able to totally empty my bladder, and we knew something was going on, but we didn't know what. My urologist had checked my bladder, my kidneys, they looked okay, so we were really puzzled as to what was going on until I ended up in the ER on the 7th of July, and that's when they found the ovarian cyst, and it was so big that it was pushing up against, like I said, my bladder and bowels, and that's why I'm not able to fully empty. Needless to say, it's been causing a lot of problems. That's basically my update for now. I am gonna have to go back to the gynecologist and we're gonna reevaluate and talk about the plan. Hopefully by the time I actually get medical clearance and I'm allowed to have surgery, maybe by then they'll shrink enough to the point where I could just have a laparoscopy. That would be awesome, because that's just a minor surgery. So let's hope and pray that that'll be the case. My Sjogren's has been flared, my inflammation has been way up, my arthritis, EDS, all my pain is flared. Everything is like flared right now. My mast cell activation is keeping me up every night. It wakes me up every night at least 1 to 2 times a night. But yeah, I'm not here to complain. It could always be worse. So I have a gynecologist appointment. I actually was supposed to have it today, but since I didn't get medical clearance, there was really no point in going today. I am going to go back to my cardiologist in 2 weeks, and hopefully I'll be more stable and be able to get medical clearance for surgery. I just want this taken care of. I already have adenomyosis and obviously a bunch of other illnesses to deal with, which cause daily pain, so I really don't need additional problems. Honestly, I've been considering like a full hysterectomy as somebody with severe adenomyosis. I mean, that's childbirth pain every month. And I've had that since I was 14. I started my cycles at 11, and by the time I was 14, they were horrific. It was a nightmare every month, and it still is. And actually, I think I told you I've been having 2 periods a month, so more reason to get it all out. I am on blood thinners for life for a chronic blood clot, so I do have to be on those blood thinners every day for the rest of my life. I have no choice, and that makes me bleed more. It makes the adenomyosis worse, so yeah, that's kind of where I'm at right now. I think I will mention a hysterectomy when I see the gynecologist. The gynecologist is on vacation next week, unfortunately, so it's going to be a little bit before I see him. But hopefully by the time I get back into the gynecologist's office, I'll have medical clearance. Hopefully my heart and blood pressure will stabilize. Thank you so much for watching. If you like this video, please give it a like. That would really help my channel out. And I will see you guys in my next video. Bye.